I'm Cathy Riley. I'm Managing Director of Shropshire Care Group from the 1st of June. I've been working in the Trust for about 11 years as a Director of Pharmacy, and for the last 3 years as Head of Mental Health Services for Shropshire, Telford and Wrekin. So Shropshire Care Group consists of adult mental health services across Shropshire, Telford and Wrekin. It consists of 5 wards at the Redwood Centre, 3 adult acute admission wards, 1 challenging dementia ward and 1 older adult ward. It also consists of 2 crisis home treatment teams, RAID liaison teams at the 2 South hospitals, which are Royal Shrewsbury Hospital and Princess Royal Hospital in Telford, the single access point team and the community pathway teams, which operate across West and East Shropshire. 3 priorities for my new role. The first one is sort of externally focused. There's a lot of work going on in STP across Shropshire, Telford and Wrekin, and I really want to now have more time in the Managing Director role to be more externally focused, being a really good system collaborator. And I suppose by the system I mean the 2 local authorities in Shropshire Council, Telford Council, SATH and Shopcalm, who's our community services provider in Shropshire, Telford and Wrekin, and really helping them around particular projects that are happening in the STP. There's Shropshire Care Closer to Home and the Telford Neighbourhoods programme. And also many of you will be aware that Shopcalm was out for procurement over the last 12 months, and we were shortlisted together with SATH for Shopcalm. And it's just recently been decided that actually the decision as to where Shopcalm will go will be taken through an STP working group. And I want to be very influential within that group because I believe that the community services in Shropshire would be best placed with ourselves in Shropshire Care Group. The other 2 have got internal focus. One is I'm looking forward to the CQC coming back and inspecting the services in Shropshire Care Group. And I really want to be able to tell that story properly and get the staff telling our story properly, because I believe we could be showcasing our outstanding services and also make sure that our other services, or at least get a rating as good, because I think that's what the staff and our service users and carers deserve. And the third priority is we've been over probably the last 2 years been working very much around a devolved decision-making, collective leadership approach, where we're devolving decision-making wherever we can down to team level. And I want to continue that. We're going to have some corporate services staff joining us in Shropshire Care Group. I want to make sure they're part of that and that we continue that journey to having a multidisciplinary decision-making for management and leadership decisions, as well as clinical decision-making. I think it's the right thing around parity of esteem, that actually we skill the staff up, we understand and can care for patients who've got physical and mental health conditions. And I think that's really exciting. I know in Shropshire we've got some highly skilled staff, and I think we need to maximise the potential of that for the benefit of service users and carers.